call, yes.
Hi, Dr. Salvador.
Okay, so why we decided to start this series, we wanted to reach out to our RI members during this time when many countries are in different types of lockdown. In some places, we may call it stay at home or the ECQ, movement restriction order. In Singapore, actually, we just started today the circuit breaker measures. So before this, we were just encouraged to stay at home, right? And social distancing, physical distancing. But today, April 7, is the first day of 1 month of circuit breaker, where really for the first time, schools have been closed, workplaces have been closed. So other than essential services, offices are closed and you have to work from home. So in this time of social distancing, but we like to call it physical distancing, but social solidarity. So we can still reach out to people in the communities, although we are even encouraged not to visit your extended family or your family members who are not living with you, but you can be in touch with people through Zoom call, Facebook, WhatsApp, Messenger, any form of technology where we can actually reach out to people, not just in our own country, but everywhere globally. Now we can actually be closer with the people who we don't get to meet normally even.
All right. So again, welcome everyone to the pilot episode of Royal Institutions C-Day Tuesday. So as discussed by Mr. we will be discussing personal experiences, adventures during this difficult time. So we will not be having this as formal. We will just talk conversational setup. Okay, so since the start, I will ask. My first question is: since today is the start of the new stricter measures in a bid to curb spread of COVID-19, in your own opinion, do you think it will have an impact to curb the spread of COVID-19? And then how is the situation differ from before to now until May 4th?
Okay. Yes, hopefully, of course, the intention behind these new circuit breaker measures are to play a bigger role in flattening the curve, right? And the intention for that is because we don't want to overwhelm our medical facilities, right? So for Singapore, what we have, which I think some other countries are implementing also now, is to have community isolation, right? So here we have 2 facilities already where once somebody is tested positive, they will be hospitalized, right? But we know now that there's such a wide range of reactions actually when somebody is positive. It could be a really mild symptoms and all the way to requiring the respirator and severe pneumonia and lots of complications needing to be in the ICU. So now we have this. Even to be discharged in the Singapore context, you need to have 2 negative tests before you can be discharged. So what they have done is to have us facilities for community isolation where they are no longer needing serious medical attention, but where they're still positive, so could still be infectious. Right? And one thing we noticed is that in our daily updates, we get the total number of cases for the day, total number of people still in the hospital, number of people in quarantine, and number of people who have been discharged and fully recovered. So, and yeah, up to today, we had not done such strict measures, and hope that the social distancing or physical distancing would be enough. But because it has already reached a stage of local transmission, that's no longer possible, and therefore the government had to implement this circuit breaker, which hopefully would only be for a month. But of course, we've been warned that if people don't cooperate, it will be longer, right? Like I understand in Malaysia and in the Philippines, it was 2 weeks first,
Yeah.
and then extended again another 2 weeks just yesterday, just last night.
Mhm.
So I don't know whether 1 month is optimistic, or I mean, we have to see how the situation goes as the situation is changing. So yeah, and such a fast pace that as and when we have to change the position. Also, another big change that happened is when we got our first case a few months ago, the government advised us not to wear any mask. Only if you're feeling unwell, then you should wear a mask. And it's more to protect others so that you don't pass the virus if you have it. You know, when it was thought that it's only through coughing mainly that it's being passed. But now that it has been proven that even people with no symptoms at all, and because of the incubation period, you can still pass it on to others, right? So now we are no longer discouraged from wearing masks, but I think we should take it one step further and actually always wear a mask when we have to leave the house, which should only be when necessary, and not trying to interpret the rules in a loose way, just like, people are making excuses to go out to buy essential things. You might only need to go out once a week or once in 2 weeks. Yeah. But even in the UK, they have 4 reasons that they can go out. They can go out to exercise, to buy food,
Yeah.
So, we hope that people will take it more seriously so that it will just be 1 month and not have to be extended.
Yeah. I understand. So in the past months or in the past week, Singapore has been hailed because your government led the safe distancing or social distancing campaign. So what do you think can we learn from, what do you think is or are our takeaways from Singapore's example?
Okay. I think one thing that Singapore has done well is to have official communication channels. So we have this gov.sg, which is a centralized system where we get across ministries. So Ministry of Health will update, and we can actually subscribe to a WhatsApp service where we get twice a day updates, right? And then another thing is the transparency. So we have up to date on all those figures, not just the total number of positive cases, but the number in quarantine, number hospitalized, number discharged. Right? And now when we had our second wave of cases, where a lot were transport, not local, but people who came back from overseas, right? So that number for a period, that number was higher than the locally transmitted cases. But in the last week, it has reversed already, and that is why with all this data, I think the government and the ministries involved can make decisions based on the scientific data available at the time. Right? And another thing that we have an interministerial task force where we are kept up to date. And so as citizens, we can trust the government and follow the instructions instead of, And that's another thing where I know that many people are unhappy and feel like they are stuck at home. But it's all in our mindset and the way that we interpret the situation, right?
Mm-hmm.
If we cooperate, I mean, and also it's a vicious cycle. Like if we cooperate, then this will hopefully be over sooner. But the more we try to be creative and try to find loopholes, then the longer this can continue. And yeah, I think we get messaging. Another thing that Singaporeans is we have very clear messaging, which is consistent. So it's to stay at home for the safety of all and the health of all are, in the hands of each one of us. And why staying at home is not something insignificant, but something that is actually our important role to play unless we're a frontliner or have to do an essential service outside home. Right? So it's something that we should be taking seriously, our social responsibility. And also our PM has been doing broadcasts, right, which I have seen in my Facebook feed, a lot of people, whether Singaporean or not, sharing his broadcast and saying like, I have received feedback like they feel reassured after hearing his podcast.
Okay, so there is also another thing is that the contract at the heart of Singapore's battle plan is what they call the contact tracing.
Yes. Yes, that is something that Singapore has been serious about, and until now, and they have told us at the start that if it gets to be too many cases and no longer viable, they will stop that. But until now, they're still doing contact tracing. So I think that's another statistic that we're contributing to the data there, which is how infectious it is, and whether we have these super spreader. But yeah, I mean, to be more sensitive, it is not a spreader but a super incident which can spread, right? Just like how in a church in Korea, it can be spread quickly at one event or at a choir in the US. So at a choir practice in the US. So these are the ways that we've been dealing with the situation, and that we have been advised that we are still continuing to do the contact tracing. There was an app just a week or so ago called Trace Together. So you have to subscribe to the app, and then it will help the contact tracers.
All right, so at this point, I'll ask you, what are your words of advice for those who are affected by this pandemic?
I think everyone is affected. I don't think anyone is exempted from what is going on, because another thing is that although we were first very concerned about people dying and our body immunity, another thing now is the financial impact that is being felt on a global scale. I mean, I know in India and the Philippines, it is, for some people, they could say like they are not afraid of dying from coronavirus, but they'll die of hunger, right? So that is something that is really alarming and sad, something to think about what we can do to help these people in this situation, right? Which is why I also read that as long as there's one case still of somebody being positive, the whole world is affected. So as much as countries close borders to try to limit the spread of this disease, it is, we cannot isolate ourselves, because once the borders open up again, as long as there's one case out there, it will be that all of us are not safe, right? And we can see, Changi Airport is one of the busiest airports, right? Yeah. Our Terminal 2 actually closed yesterday, and it will close for 18 months. So 18 months, yes. So people that we know personally have lost their jobs. Another thing also, Singapore actually just had our budget very recently, but since then there have been two more I'd say supplementary budget where more help has been offered, in order to save jobs, right? So actually, one very concrete thing is for the month of April, 75% of the wages of employee will be subsidized by the government across all industries. Okay, so like about 2 weeks ago, when this measure was announced by our finance minister, who's also our deputy prime minister, it was 75% only for the airline industry, right? Because the airline industry is really badly hit, right? But then in the next version of the budget, which he released again just recently, I forget the date, was now 75% across all industries for the month of April. So from May, it is back down to 25%, 50%. But that is a very significant move. Of course, there's a cap it's not an unlimited 75% of 4,006, but that is the median and affects a lot of Singaporeans. So the intention behind that is to save jobs. So that is one of the examples that I think also one thing that citizens were very happy to see is that the ministers gave up 3 months of, there was a 3-month pay cut, which they initiated in order, so we have this solidarity, resilience budget, and we feel this SG United. So it's something maybe like that could be considered or adopted in other places, just to feel that we are all in this together. But that's also another thing. It's not country by country, but it's the whole world. We're all in this together. And now that we are also in